Okay, so now I'm going to show you a three-dimensional model and explain to you some of the pathology that happens in a way that's a little easier to see because it is three-dimensional instead of the MRI imaging there. Let's take a look at these models for a moment. This is supposed to be an example of an ideal spine without any significant degenerative changes. This represents a young person. These are the vertebral bodies or the bones. This happens to be in the low back or lumbar spine. This is a disc in between the bones. Of course, there'd be a disc above that, and there would be additional vertebrae on top of that, like so. If you look at the vertebrae and spine from above down, you'd see it like this. This is what the disc looks like from above down. There are 12 to 20 layers, concentric layers of tough fibrous tissue. They're oriented at 30-degree angle, and one layer will be oriented like this with its fibers, the next like that, and so on. This makes it tougher and stronger and resistant to stresses like pulling in a variety of directions, so that it's as tough as possible. Unfortunately, it still fails in too many of us. But anyway, the outer part here is called the annulus, and this is what we saw in MRI scan a little bit ago that had a little tear in it and was highlighted white in color because of the swelling there. In the inner part of the disc, there's a gelatinous component that has the consistency of toothpaste, and it acts like a ball bearing. And when there's compressive load, such as when you're upright and there's compression, then this gets compressed and it expands outward, putting and distributing the stress to all the fibers of the rings of the disc. Unfortunately, over time, the inner rings of the disc begin to tear, and because there isn't a blood supply to the inner part of the disc, tears and degenerative changes do acquire and aggregate and accumulate over time, and then eventually those tears reach the more peripheral fibers. The process when it's on the inside isn't felt because it's also not a structure that has nerve supply on the inner fibers. So as this degenerative process proceeds, we get accustomed to abusing our backs, and we don't get painful feedback that tells us that this or that isn't a particularly good thing to do for the back. So we get accustomed, and I think sometimes spoiled, to abusing our backs in ways that are not good. Eventually, the damage reaches the outer peripheral fibers. When that happens, you start to get and experience pain, and that teaches you that you can't do that particular activity. And then you have to reconcile the misinformation you were getting when you were abusing your disc and were not receiving pain signals with the new information that's telling you that, you know, you're not young anymore and you can't do the same things and you can't bend over for prolonged periods of time or bend all the way over or do it repeatedly or lift too much or any number of other things that are physically demanding on the disc. But let me continue with the rest of the anatomy here. I'm going to turn it now so that this is the back. If you felt the back of your body, you would feel these hard bony processes or spinous processes. And if you look here, this is supposed to represent the spinal cord and or nerve roots, depending on which part of the low back we're at. Because remember, I mentioned that the spinal cord ends at the upper part of the low back, and then beyond that point, the nerve roots continue down this canal in the center, and then they exit out in pairs from behind. And these paired nerves then will come out, branch, coalesce, or aggregate together. They'll split up again, and they'll run to different parts of your anatomy: muscles, ligaments, tendons, bones, all that, and serve a variety of functions in the buttocks, thighs, legs, and feet. I'm going to put this down for a moment and show you another model. This is supposed to represent a little older model that started to acquire some of those radial tears that start from the center, and the tearing that starts in the center then permits the gelatinous component, or what we call the nucleus pulposus, to migrate through those tears and towards the outer boundaries of the disc. That happens particularly in the back because we abuse the back part of the disc more than we do the front part of the disc. The back part of the disc is subject to a lot more pulling or stretching or tensile stress, because when you bend forward, that stretches these fibers, and there's a large load on them, and over time you get these accumulated tears in the disc. Once it reaches again the peripheral fibers, you'll start to feel pain. And it so happens that right behind the disc in the back here, you don't see it at this level because I don't have any vertebrae above there like that, but there would be, as there is in the level below, there would be a pair of nerve roots that exit here and here. If this disc should come out further, and I'll show you just a moment with this model what that might look like. If it comes out further through accumulated tears, it can bulge or herniate. That's what we're depicting here. And there would be a nerve root that's going, two nerve roots, well, several, that are traveling down the central canal and then exiting here. So it can hit nerve roots as they go down the central canal, or depending on exactly where this disc herniation is, it can sometimes impinge the nerve root above, other times the one that's headed to the next level below and exiting. In any case, that is what a disc herniation is. There are technical differences between bulges and herniations. They're not necessarily important clinically, and it depends on who you speak to. Different medical bodies define these differently. But for the layperson, what's important is whether or not you have pain associated with that bulge or herniation. Some bulges and herniations are present and painless. Some are painful. And a review of your clinical findings and MRI is important to determine what your exact problem is. Let me move on to the next model here. This model is supposed to represent an older spine. At this level, it shows a disc herniation. This herniation has migrated up that way, behind the vertebral body, so it could potentially hit this nerve root or the one exiting from the level below. This model also shows a collapse of the disc. If the disc loses a lot of water content, then it will lose height like that, and you can sometimes end up with bone on bone. You can also end up with deformities or misshapen vertebral bodies because of the stress on the bone, because the cushion of the disc isn't there anymore to alleviate the compressive stress on your spine each day. So you can end up with a collapsed disc there. That would also mean that the little hole here on the side is smaller because these vertebrae are not separated by the disc as much as they were when the disc was intact and thick and high and normal. Another pathology that's common to the low back is there are numerous ligaments back here that attach the bones to each other. Sometimes they enlarge. One in particular back here can enlarge. That's a common contributor to what we call spinal stenosis. Spinal stenosis just means narrowing of your spine, and it is a reference particularly to the hole here, the central canal, or the holes on the side, the foramina in the canal. So you can have a number of pathologies here in the spine that make the space here smaller or there smaller and cause narrowing or stenosis that causes pinching of the nerves and compromises your function and is a source of pain. Some of the things that also happen is that when there's more pressure on the bones back here, they, like these bones, also enlarge. If these bones enlarge, they enlarge in all dimensions, like this, and that's also going to make a smaller space here in the canal. So there are a number of changes that happen in a degenerating spine. Almost all of them eventually result in narrowing of the holes and spinal stenosis. If the problem is bad enough, you have to perform surgery to remove some of those tissues, including bony tissue. If it's not bad enough, then you may do fine with just physical therapy and or pain management. We'll get into all those topics of treatment in just a moment. But that's it for the anatomy of the spine.